I think there were a few issues in Bassetlaw, and we are, I'm sure, no different from other areas. We had a problem with lots of hospital admissions in the acute trusts, and lots of admissions with those with long-term conditions and multiple comorbidities. And our priority was to look after patients in their own homes in primary care and try to reduce what are sometimes avoidable A&E attendances and hospital admissions, and also sometimes inappropriate. This is about helping patients to look after themselves. This is about primary care doing things that primary care should be doing. And this is to keep patients out of hospital unless it's needed. So when we did the Bassetlaw CCG strategic operational plan, we decided we would include telehealth, and the way we were going to introduce that was to have pilots. Riverside Health Centre in Retford was one of the pilots, and also Newgate Surgery and Worksop. Very much from a patient point of view, first of all, these are patients with long-term conditions. We want them to be able to understand their conditions better, to be able to manage them. And I think that a big thing that patients tell me is about not having access to primary care professionals when they need it, be able to ask them questions, and not being able to access as well at a time of their choosing. So from a patient's point of view, there was a big fear factor and anxiety over their illnesses. From a GP's point of view, I think the frustration sometimes, we know what we would like for the patients, but sometimes with a lack of resources and the pressurized GP environment of 10 minutes to get what you want done for them to answer, to help them have the confidence to manage their conditions, sometimes it's not easily achievable, even with the nurses. So I think the way I view telehealth here for patients is telehealth is an extra part of the team, bringing more capacity within the primary care team, and so patients can access this team, this service and this team at home, when they want, how they want. So that's from a GP's point of view. Patients benefited from building a trusting relationship with the care navigators, speaking to them on a near daily basis. You build that confidence, you build that trust, and when you build that trust, they are more likely to receive the coaching advice. I've listened to how the care navigators coach and advise, and a lot of motivational interviewing techniques I use, and the outcome of behavioral change is actually pretty dramatic. Just on a Riverside's point of view, on those 50 patients that were referred into the service, we've got to be careful. With Riverside, there was a small cohort of 50 patients, but even with those 50 patients, in 6 months, when we audited their GP attendances 6 months prior to going to the service and 6 months after, it was a staggering 56% decrease in primary care attendances, in GP attendances. Now, when you look at those 50, and there were 10 to 15 that had quite a number of A&E attendances, and even more staggering, just from a Riverside's point of view, 70 to 80% reduction in A&E attendances. I remember one patient who used to attend A&E once every month. In that 12 months she was with telecare and telecoaching, not a single A&E attendance, and that was for her, from her ability to have confidence and self-manage her illness, a huge benefit to her, let alone to all primary care services and secondary care services.
My name's Paul Hughes. I'm the Barnsley Care Navigation and Telehealth Service Lead, and I manage the service, which ultimately provides telephonic support to Bassetlaw CCG and also telehealth services too. The Barnsley Care Navigation Telehealth Service is provided by the South West Yorkshire Partnership NHS Foundation Trust. We provide services in Barnsley and also Bassetlaw. Within Bassetlaw, we provide a telephonic care navigation and health coaching service that assists patients with providing information regarding self-management of the long-term conditions, and it's all done telephonically. Ultimately, our service is to provide advice, information and support, and to signpost patients to the appropriate services and identify any needs that the patient may have that's not previously been identified by a clinician or a worker from a social care perspective. We provide telehealth services to Bassetlaw CCG. In respect to the telehealth services that we provide, we install electronic devices in patient homes, and their heart failure and COPD conditions are monitored remotely by a team of nurses based in Barnsley called Nurse Care Navigators. On a daily basis, those nurses review vital signs, symptoms and behaviours that's transmitted by the electronic device that the patient's got via the patient's telephone line to our nurses, and then we undertake clinical triage and notify frontline clinicians if a face-to-face intervention is required. The benefits of telephonic health coaching support to patients is that it enables a patient to better self-manage their individual long-term condition, and they can do that by us empowering them, providing the skills they need and the information they need to make the right decisions in respect of the management of their specific long-term condition. Patients benefit by feeling more reassured that there's a nurse actually monitoring their long-term condition on a day-to-day basis, and that there's a nurse that is monitoring that condition and will intervene if the nurse feels it is required. In respect of telehealth benefiting the NHS, the wider NHS and GP specifically, patients that have accessed telehealth, both in Barnsley and Bassetlaw, have seen a reduction in the need to access their GP services. So from a GP that's referring patients to access the equipment, we have seen locally that there has been a reduction in footfall of those patients to access GPs for emergency appointments. There's also been a positive stance in that we have seen a reduction in secondary care, hospital admissions, emergency admissions through patients using the telehealth equipment.
It's going back to 2001, isn't it? He had a cough since September, went to the doctor, he says 3 days before Christmas, want you to go up, have an x-ray. Went and had an x-ray. You went back to see the doctor, didn't you?
Yeah.
And he said, come in Mike, sit down.
Yep. You think straight away, that sounds out ominous, don't you? But went in and sat down, and then he says, you did work down a bit, Max, didn't you? I says, yeah. He says, well, it looks as though you've got pneumoconiosis, chronic bronchitis, emphysema, and then I had to go and have another x-ray for osteoporosis at spine. And that's just start of it,
That was the start of it, and just carried on from there, didn't it?
Yeah.
And he woke up one morning and he says, John, I can't move. I says, what's the matter? He says, I've got an awful pain. So he says, I think you better call 999. And he'd got pleurisy. It was at that stage then when Max decided enough was enough, and you couldn't work anymore, didn't you?
Yeah.
In a way, it was better really, because he was working in conditions that were cold, and at the end of the day, Max has got COPD. You're working down the pit.
Well, it means you can't know very much of anything. Some days you're so out of breath that you haven't got the strength to do anything.
When Jane said, did we want the telehealth service, I said, oh, I don't know, what is it? Then when they brought the machine, I thought, I don't want that stuck on my whole table, but no, it's been brilliant. And both the services are brilliant. They're only a phone call away, 0800 number to Andrew, 0177 to Retford to get a community matron. That gives me peace of mind, doesn't it, as much as anything. If he's out of breath, I can put the pulsometer on and check his oxygen levels, which I did back in June when he wasn't very well. We got up, and normally Max goes to get washed first, don't you?
Yeah.
And that particular morning he went in, and next thing he sat on with the lid down on the toilet seat. Jan, I want you. I says, what's the matter? He says, I can't do anything. I says, what do you mean? He says, I can't wash myself or shave myself. I'm so out of breath. Next minute I come down, he really could not get his breath. So I came in here with the pulsometer and I checked his levels. His oxygen levels were down to 86 and his heart rate was up to 135. So I rang the doctors, and Dr. Eason came back and said, tell Mrs. Brown to ring 999. So I rang 999, of course it was admitted and in there a fortnight. So without the telehealth, we wouldn't have known what was what. We would have just been sat waiting for a doctor to come at dinner time, and while he was struggling. So yeah, it has made a huge difference. We're more confident, and I know I can pick something up and say, what shall I do? Max is really not well. Do I ring 999 or do I ring for a GP to come out? Yeah, it has changed it immensely. So I hope they're not going to take it away from us anytime soon.
When I was 16 years old, I had rheumatic fever and I had heart attacks later and then developed COPD. So it's been a lifetime thing for me. For 20 years or more, I was in a wheelchair. But as time got on, I got older, I got stronger, and just got back to what I call normal. Don't walk very far, but it's good, you know, to be without it. Got my legs up the corner there. If I'm stuck, I call them my legs. It has been a lifetime condition, really, since I was 16 years old. I'm a social person. I like people, but I don't go out only once a week. It's made a terrific difference, yes, because I feel there's somebody there that wants to hear from me. You can spend 12 hours a day alone, never see it so, day after day. But you're not alone. It's very easy to use, it's quite simple. If you can count to 100, you can use that. It's so easy. And if you can read, it's easier still. And if I've got a problem, I can just pick the phone up. I find it extremely useful. It's there for me to use. I get a lot of benefit from it. It's nice to have somebody to talk to in the morning. I suppose it is, you know, because it is like talking to somebody. It's a great support, and it's a comfort to know that there's somebody there. Whatever figures go on there, I'm not happy with whatever. I can pick the phone up and ring those people, talk. Our service, and the service I get with that, and the health service, is second to none in Bassetlaw. It really is second to none.
condition is myotonic dystrophy, which is a neurological disease, but it also causes diabetes, high blood pressure, cholesterol. It's got a lot of side effects to it. And the worst one that I find hardest to control is the diabetes. That's the only one to take medication for. I was learning to drive. I got hold of the gear stick and couldn't let go. And I went to see the GP. And he said, oh, you've got arthritis. So treated me from 17-year-old for arthritis. Then I had a daughter who had no problems. And then I had Becky, who has got myotonic dystrophy. She was diagnosed when she was 2 days old. And they said, well, it's come from somewhere. So I was tested. Yes, I've got myotonic dystrophy. And even though they've been treated me for arthritis, I haven't got arthritis at all. I've got dystrophy. And my legs are weak now, I can't walk very far. In fact, I can't walk at all without pain. It makes my hands weak, I can't do the daily tasks in the house that I used to do. I can't cook anymore because I can't lift the pans. I can't get down and wash the floor because my knees are weak. I can't get down on the floor because I can't get up again. I have to be careful what I do. When I got a phone call, that was the first thing I knew. It's just a great way of getting your niggles out of the way, rather than having to book to go and see the GP and have a long list of what you want to ask. You can just stand it over the phone, you're talking to a qualified nurse, so they know what to tell you and they know how to put it right. You've been to a GP, they've told you something you don't understand, they'll explain it to you, you know. It puts us in touch with things like insurance that we found hard to get. He told us how to get insurance for holidays, he told us how to get a cleaner to come in the house, help us, what you can use your PAs for, all sorts of things. It's not just about your health. I don't have to go out to the GP. I can do it from in my own house. I don't have GPs come out to the house, but with Andrew phoning, I read the letter to him and he says, oh, it means this, this and this. And it was nothing, but I was worrying about it. But I thought, I don't want to bother my GP. And also, I think because you're not sat face to face with somebody, it's easier to say what you want to say. You're not embarrassed by, like if you go to the doctor and he's looking at you, you know, and I think it's just easier if you can do it over the phone. It's just handy. You know, I can be in bed one morning and I think, oh, that didn't feel right. And then Andrew will phone and I say, well, I've just had a pain and sort of, and I know Andrew can't do anything over the phone, but it can make me feel better. And it's more psychological than anything, I think. You see, because now I can talk about my condition. Whereas before I couldn't talk to anybody about my condition. You go to the GP, you've got a 5 minute slot and you're out, you know. And if you go about something in particular, by the time you've sorted that out, you haven't got time to talk about what's bothering you. But if you can talk about what's bothering you, you get over it better.
The heart attack came out of the blue. It was a big shock. But the treatment I had locally and in Sheffield was absolutely brilliant. I had me back on my feet within 2 days. It was amazing, the operation to put the 3 stents in. The staff and the guy who did it were absolutely brilliant. Kept me at ease. I've had a lot more pain from the dentist. And when the health buddy thing turned up, I thought, I don't know what I'm going to see or what I've learned from it. But the main thing with it built my confidence, which had taken a big knock. Switch the machine on and it runs through a certain amount of questions, simple questions like how you've taken all your medication as you're supposed to questions about whether you're feeling depressed or not depressed, or whether you're feeling short of breath. It told me, right, it's time to take your blood pressure. I put the cuff on, press the right buttons in the right sequence. It measures my blood pressure and gives me a readout. After the blood pressure measurement, it asks you to get weighed. Simple process. You press the right buttons again, stand on the scale, and it gives you a readout. The job's done, and that's it. The reports have gone off. It's just like going to the doctors in a way, but it's a lot easier. And you can do it at your own pace. It can take an hour, or usually I'll spend about 5 minutes. Get up in the morning, have breakfast. Sometimes I do it straight after breakfast, but usually it's between 11 and 12. And it's just a routine. Oh yeah, must do the whole body. And then it's always online. Switch on, go through the questions, get weighed, take the blood pressure readings, which I now understand, which I never did before. Well, the blood pressure readings I understand now, and I think, well, yeah, that's a good level. I'm okay. Again, back to the confidence, but it's great. In a way, I don't think I'd lie to me without it. You know?